Hi, my name's Samantha Powers, and I'm going to go over a debriefing of a video that we watched of a patient and nurse interaction. During this simulation, the patient had just had a baby, and the nurse is reviewing discharge instructions with the patient. During this, there was different things discussed. There was a lot of areas of where care was not exhibited throughout the nurse's interactions with the patient. The nurse seemed to care about some concerns and issues related to the patient, but she didn't go any further with them. Behaviors that were seen that did not show caring when she initially walked into the room to start discharge teaching. She asked the patient if the patient knew how to change a diaper, and the patient stated she didn't know how. The nurse didn't ask any further questions. She didn't appear to be concerned, and she just showed the patient how to do the diaper change. So that's a little bit concerning because initially she said, "All right, we're in here. You're going to show me how you can do the diaper change," and then she went ahead and did it herself. Um, when the patient stated that she did not have a home, the nurse also didn't seem concerned. She didn't wonder what her plan was. Is she going to stay with someone else? Does she have family? Does her boyfriend have a home? The nurse was very unaware of where the patient was even going to be going with a newborn baby, which is scary. Um, when addressing the patient's pain, the patient initially asked if she was going to be going home with the Percocet or I guess whatever she was having for pain there. And the nurse said, no, the doctor's going to send you home with Motrin. And the patient said, well, Motrin hurts my stomach. And the nurse just responded that she can talk to the doctor about it when she goes to follow up. Well, most of us know that after having a baby, it's not always very pleasant for the week or two after. And if I was going home with no pain medicine at all, I would be concerned if I couldn't take Motrin. Um, the nurse actually goes out and expresses some of these concerns with another nurse. She realizes that, something is not right. And, instead of looking for a solution or asking for recommendations or, what she might be able to do, she just complains about being busy and just needs to get the patient out so she can go ahead and turn over the room. Um, I would have been really afraid to send the patient home with this behavior. I would have tried to get more interaction, maybe probe more at some of the statements that the patient made to find out what's going on. Is she depressed? Is she, doesn't know what she's going to do? Um, I would have spoken with her regarding resources or things maybe that might help get her a little more excited to interact more, kind of give her a little bit of hope that there's things that she might be able to do to help some of these scenarios, such as not having a home or not knowing what she's doing. The patient's priorities weren't expressed except for, she did state she was concerned about the pain. So that could have been another thing, was the patient just in so much pain that she didn't want to do anything? The patient needed pain management would be important to ensure that the patient could go on taking care of herself and the baby after discharge. The nurse's priority during the simulation really just seemed to be that the patient needed to be discharged, and that's what she was going to do regardless of the circumstances. Resources that could be used for this patient are things like shelters in the area, maybe low income, affordable health care, that may be easy access to that. Information on places that serve meals, maybe Meals on Wheels and food pantries, maybe even drug cessation and alcohol cessation hotlines or mental health crisis hotlines, in case something were to go wrong and the patient needed help immediately. Um, I would be mindful of the way I deliver care, especially after seeing this. It makes you stop and think. We get so busy throughout the day and we're just go, go, go. We really need to stop and listen and address the concerns that we notice, regardless of what's going on around us. Um, I would like to do this because I don't want to be someone to overlook something and then place a patient or a newborn baby in danger. This patient has a lot of areas that need addressed prior to discharge. Case management needs to be involved, a social worker, um, somebody that can follow up with her after she discharges to make sure that she's safe and the baby's safe. Um, I would always use my discharge paperwork. We want to be able to go over things fast, but going through that paperwork step by step and making sure we don't miss anything as far as, activity and diet and exercise and medications and side effects and, follow up appointments, which are very important. I would ensure that if I had concerns, that I would address them with the other team members so that I feel fully comfortable with the kind of care I'm providing. I don't want, if I have concerns that I can express to another nurse, then there's something that needs to be done. And that's, as a nurse, we're here to advocate for our patients, and that's what we need to do. Thank you.